Welcome back to N-Powerment Nursing. I'm Linda, and this is Ashley. You are tuning into our series In the Know, where we make it simple. And today we are simplifying why test questions are not studying.
So, as you know, there are a multitude of resources available to students who are preparing to write the registration exam to practice test questions. These are also often referred to as test banks. We see in our experience with many graduates, a number of graduates make the mistake of using test questions or running test questions in a test bank as a means of studying. So today we're here to talk about why running test questions is not a form of studying. So we're going to point out a few things as to evidence in terms of this. So we're going to start with number one. Why are test questions not studying? You begin the study process with content, right? And not with questions. Go ahead, Lynn.
You should not begin the study process by testing your content knowledge without first reviewing the content. This isn't logical, nor is it helpful. There is content you might not have looked at for a couple of years. For instance, if you took maternity in year 2 and now it's year 4, or if you're writing the PN exam, the beginning of your program you may have studied content and now you're at the end of the program, and so it's very important for you to get back to the content. Test questions are supposed to do just that, test your content knowledge.
So point number 2, they make you sad, put simply. Let's talk about how if you run test questions before you go back into the content and you feel good about your knowledge, it's going to lead you to having feelings of inadequacy, stupidity even at times. Because what's going to happen is instead of you studying and knowing your content and then running questions and those questions rewarding your study process and your knowledge, your eyes are going to be opened up to how vast the knowledge base is that you are not familiar with. So your study process is then turned into something negative where you're constantly telling yourself, I don't know enough, I'm going to fail, I'm stupid, I'm inadequate, I'm unprepared, which of course will lead to feelings of anxiety, and none of this is conducive to your study process.
It points out what you don't know. It's like in school when you may have decided to go into a study group with 4 or 5 other students, and you go to that study group without studying and everybody studied and you haven't. How horrible that is for you. How it just makes you feel like you're not at all prepared. So this is another reason why one should not do that.
And finally, number 3, practice questions will not show up on your registration exam. They will not be there. And we talk about this often.
Yeah. Nobody knows what's going to be on there, and particularly out of questions that you'll find from any source, they are not going to appear on your registration exam. The only approach guaranteed for you to work is to actually get into the content and do the hard work and study so that you critically know and deeply understand the content. There is no shortcuts to passing your registration exam. You must comprehend the content and be able to understand the non-changing principles and the priorities. That should be the goal of your study process.
So Linda and I aren't saying that there's no place for test questions in your study process. Of course there is. You study your content, you know your content, and then you test your content knowledge through questions. This is very different from just running 500 or 1,000 questions as your study process, because as Linda spoke to, the questions that you're using to practice are not going to be on your exam. So what is the value in that? Unless you're taking some type of rationale to the right answer of those practice questions in a way which can apply to any question you're asked, it's an utter and complete waste of your time. What we've done in our textbook is we've done all of that work for you, and at the end of every chapter in our textbook and a good portion of the back of the textbook, we have one-line takeaways from all of the body sections and systems. So basically what we've done is we've taken the rationales from the right answer to a multitude of test questions and put it in ways which can apply to anything. An example might be, if this happened, you're going to phone the physician. If this happened, you're going to sit up the patient before you put on oxygen. If a patient has a cardiac catheterization procedure, the right assessment of the nurse is the distal pulse, not the incision site. So these types of things that come from running test questions, right? But you take that one thing away from it that you can apply to anything, no matter how that question is worded on your registration exam, because of course it will not be the same as any test bank.
Absolutely. For more in the know and for all concepts simplified for your registration exam, please check out our complete study package.
Bye for now.
See you next time on In the Know.